Good evening, everyone, and welcome to A Taste with the League of Manatee County. My name is Cheryl Kaplan, and I am the membership co-chair for Manatee County. We're going to start with some housekeeping tips. Everyone will be muted during the presentations to limit the background noise. And please use the chat box if you have any questions for our keynote speakers. We will be recording this tonight and for follow-up and quality purposes. Tonight, our focus is on healthcare as part of our league mission to increase understanding of major public policy through education and advocacy. We begin tonight with a toast. So reach for your favorite beverage as our president, Alice Newland, leads us in a toast for our show tonight.
Okay, and you can unmute yourself for this one. Our toast tonight is going to be, and wait for me to raise my glass, is going to be to everyone's health. The National League's position and what our league is working towards is a U.S. healthcare system that should provide a basic level of quality health care at an affordable cost to all U.S. citizens. Basic care includes disease prevention, primary care, including prenatal and reproductive health, acute long-term care, mental health care, as well as health promotion and education. Healthcare policy goals should include the equitable distribution of services and delivery of care, advancement of medical research and technology, and a reasonable total national expenditure level. We can do this for everyone. So unmute yourselves and ready to everyone's health.
To everyone's health.
Thank you,
I'll drink
Alice.
to that.
There's a lot of topics in healthcare and lots of opportunity there. Next, we're going to watch a video that's very brief that talks about a few of those opportunities. Sounds missing, Alice. Alice, the sound is missing. Can you unmute yourself?
Grab the wrinkly dog, 11 letters, and it's a rhyme. Grab the wrinkly dog, and it's a rhyme. Hey, my apartment's on fire. It's right around the corner. Come on. Whoa, whoa, whoa. First things first. Are you insured? Yes, sorry. Here you go. If we could just hurry though, that'd be great because my apartment's literally on fire. We got a slight issue here. What issue? It says here you're behind on your premium payments. Really? I don't think so. I do. It's right here on your file. $660. Oh, my bad. Can we just take care of that later? No can do. See your specific provider. Bright Shield Protector Fidelity Horizon says you need up-to-date premium payments for your provider to be reimbursed. Can you not talk over me? I was talking with you to support you. So the thing is, I haven't reached my deductible anyway, so it would all be out of pocket. Right, but to get credit towards your deductible, you need to have up-to-date premium payments. Okay. Sorry. Here you go. Here's my credit card. If we could just hurry though, that'd be great because my apartment is literally on fire. So sorry, but we don't take American Express talking over me. Oh, sorry. Here you go. Actually, hold up. This isn't your home precinct. It should be. I live right around the corner. New address? Yeah, we moved a couple months ago. Well, that's an issue because your primary care precinct is still tied to your former address. This precinct is out of network for you, so I'm going to need a referral. A referral? There's a fire in my apartment right now. Oh, dear. What? Did you recently change jobs? Yes, so what? There's a gap in your insurance. Your old coverage was tied to your old job, so when you shifted jobs... My home is literally burning down! Hey, could be worse. How? Was it on fire when you moved in? No, of course not. Seen it before, and then it's a pre-existing condition and it's not covered. See how it feels? I kind of like it. Oh, what? What? The crossword. Carpe Sharpe. Ooh, nice pull. This is absurd. It would be absurd if we ran fire departments like this. So why do we run healthcare this way?
Hey, I live right next door to you. Your apartment fire spread to my apartment.
Oh no, I'm so sorry.
Here, take a bucket. Can you help us?
Are you insured?
That's not so far off base for a lot of people. Thank you, Alice. Our keynote speaker tonight is Ruth Haranchar. She's a retired corporate chief information officer. Ruth started her career in public health as a faculty member of Northwestern University's medical school. Her work in computer medical data analytics soon pulled her into information technology positions, where she spent the majority of her 46-year career. She moved to Bradenton in 2016 when she retired. She's returned to her public health roots by serving as chairman of the League of Women Voters of Manatee County Healthcare Action Team and a member of the Manatee Healthcare Alliance. Ruth was also just recently voted in as our vice president of Manatee County League of Women Voters. Welcome, Ruth.
Thank you, Cheryl, so much. And I suggested that video, and I'll get to it later, but think about what the difference is between a community service and what we currently have as our healthcare delivery system. The League of Women Voters here in Manatee County for many, many, many years had an active healthcare committee. Went dormant for a while, but it's been back now for 3 years at this point, and we've been able to work on a number of things as a group. In the local community, of course, all of us were impacted by the pandemic, and so the Manatee County Health Department initiated something a campaign they called Mask Up Manatee. And our committee, as well as the Manatee League, did decide to become part of the Mask Up Manatee campaign. We had some of the information on our website, and certainly we're part of encouraging people in that phase of the pandemic. When the vaccines became available, they shifted the campaign at the County Department of Health from Mask Up to Vax Up Manatee, and we were very much a part of that campaign as well. In terms of events that we have sponsored here in the League, the two most recent ones, December 10th of 2021 was Universal Health Day. And the reason for doing that is the League has had an observer status with the United Nations since, I believe it was 1948. I may be a year or two off on that. And so every year, the United Nations on December 12th has an annual event around the globe to commemorate, but also to continue to publicize that one of the only resolutions that ever unanimously passed the United Nations, including being signed by the United States, is that in essence, healthcare is a right, and all governments have an obligation to provide healthcare to their citizens. And so every year, the League's representative to the United Nations asks leagues around the country to sponsor events for that. And we did it on December 10th in order to be able to have the speakers we had from the county and providing status on the healthcare statistics and community services here in Manatee from a healthcare standpoint. The most recent one we did was actually on March 14th, and that was on the social determinants of health. That was really jointly sponsored with the Social Issues Committee, because it is the social determinants of health actually have a huge impact on any given individual person's actual health. And so that was March 14th. In Cheryl's introduction of me, I did say I am a member of the Manatee Healthcare Alliance. This is an organization across the county, actually has its own independent board of directors, but it's considered a direct help to the Department of Health to have people from the community on this alliance, but also providers. All three of the hospitals, Blake, Manatee Memorial, and Lakewood Ranch hospitals are part of the alliance. And there are 4 standing and operating subcommittees, and I am the chairman of the Healthy Living subcommittee. And it was in talking about some of the efforts of the Healthy Living subcommittee at the April healthcare committee meeting that the committee decided that they would like to do a study about food deserts. Some people in the committee were familiar with it, but it's for some of us hard to imagine, but there are actually whole zip codes in Manatee County that do not have a place where people can go to buy fresh fruits and vegetables. And that's really the definition of a food desert. If you cannot get access to fruits and vegetables, if you cannot buy fresh meat or things like that. So we've just started a study on food deserts and the possibility of we're figuring out which organizations are trying to address that and how we might be able to help them from a networking standpoint. At the state level, the chairman of the various local leagues or county leagues that do have, not every league has a healthcare committee, but those that do, the chairman attend a monthly meeting to talk about various issues, but the main concentration at the Florida state level and the main policy that the league from at the state level supports is Medicaid expansion. They have supported it for many years, but specifically 3 years ago, they joined a coalition that has approximately 30 organizations supporting it that are trying to work with the legislature to actually have Florida expand Medicaid. Not only would expanding Medicaid mean that tens of thousands of Floridians would have access to Medicaid that they currently are not eligible for under state of Florida rules, but it would, in Manatee County, we taxpayers in Manatee County are obligated to provide indigent care. And we spend approximately $10 million a year doing that. And if Medicaid was expanded, that cost would be taken over by the federal government. More people would be given services, more types of services, and that would leave Manatee spending less than $1 million on indigent care if we were to have Medicaid expansion. The other thing that the committee chairmen do at the state level is work together to each legislative session to track any healthcare related legislation and make recommendations to the league at the state level as to what position we should be taking in terms of supporting a piece of legislation, being against a piece of legislation or choosing to be neutral. And finally, the probably true love of my life is actually I am part of a league nationwide networking group that really are focused on healthcare reform. The group is called Healthcare Reform for the US. It's been in existence for about 6 years. It does have its own website that you can get to either independently, or it is a link to the League's national website under the, Alice, forgive me, it's the administrative side of the website. And we are advocating, sometimes it's called single payer, or sometimes it's called improved Medicare for all, but it's to have healthcare provided as a government service, just like we provide firemen to fight fires. And that's probably trying to do it in the simplest statement of what the purpose of that advocacy is. At this point, I've covered several things. How about any questions, Gail or Mary?
There are no questions in the chat, Ruth.
Okay.
But I do want to ask you a personal question. I've heard you talk about this before, but I want to be very clear for myself. If we do expand Medicaid, that actually costs the state less money, correct?
Yes, the aspect is that the federal government has set aside, ever since they passed the legislation as part of Obamacare, so now you're going back a decade perhaps, and so they take that part of the federal budget and the money that they collect from all of us all the time is set aside for Medicare expansion. Any state, and there are 11 states, Florida being one of them, that have not expanded Medicare, those dollars are still collected, but then they use those dollars for other things, not for Medicaid expansion. If any state that does approve Medicaid expansion has the cost of Medicaid expansion covered by those federal dollars. So Florida legislature is choosing to leave those federal dollars to be used for something else rather than to use those dollars here in Florida for Medicaid expansion.
Well, and so the other thing I wanted to ask you was the healthcare action team is involved with so many things, according to what you just shared with us. Where do you think our league and our county could be most effective to support your efforts out there?
I would hope, following the way that the league functions in many ways, is that with the committee making a decision, they would really like to study how to help deal with food deserts, that we do that study, and out of that study, then we can look at it and see what can the league do to either work with other organizations that are trying to address it or to publicize what they're doing. So it's following the model of study a problem, see what's the best way to address it from a league perspective and who we could work with to address it that way. And so I don't have a specific suggestion right now, but that when we have finished our study and presented, that there would be support for what we would recommend.
I don't see any other questions in the chat, but does anybody want to unmute themselves and ask Ruth a question at this point? Alice?
Okay,
Right.
we're on to the question.
So we have a little fun poll for you. Your zip code is an accurate barometer of your health and the impact of social determinants of health. The life expectancy in zip code 34212, an area in Northeast Manatee County, is 80 years old. What do you think the life expectancy is in zip code 34205? You get to pick one of those life expectancy numbers in the poll there.
Which is center Bradenton. So it's got some nice areas and some areas that are not as affluent.
So do you think it's lower at 65 years? Do you think it's 71 years, 75 years, or 79 years for central Bradenton?
Okay, we have, yeah, now we're getting up there. Okay, everybody voted? Okay, we have, share the results. We've got 25% that voted for 65. 75% voted for 75, and the answer is, Cheryl?
75.
The answer is
Yeah.
75.
Sorry.
That's okay, Ruth.
Yeah, so if they lost 5 years life expectancy, and that is a mixed area that's got some people that are quite affluent in that area.
So Ruth, when you talk about the food deserts, where would you say the largest food deserts are at this point?
I meant to check that, but actually I picked 34205 because it is one of the 2 zip codes that is a very specific food desert.
Okay,
That's interesting.
I can address that somewhat. I'm not really sure what the zip code is for the health department, but the health department is located in the food desert. And we have a community garden there, which is funded through grants and from some funding from the health department because it is considered a food desert. So that's, 6th Avenue and 301.
and you're talking across the river in Palmetto.
No, I'm talking about in Bradenton. The
Okay,
health department, the county.
that's
the
what I would
county-
expect. I think that's 34208. And
Okay.
that's what I would have expected. And I thought life expectancy is probably lower in that one, but I don't know. So
I
okay.
should have checked on that, but I do know that 205 is
Yeah.
one of those that is considered critical. And Mary, thank you for that information. I meant to check on all the areas. Samoset is a terminology of a neighborhood.
That's
Samoset is the location that's been identified, at least within Bradenton. I believe Samoset is actually considered more problematic even than Palmetto is in terms of
sure.
life expectancy, the unbelievable food desert that exists there, the number of vulnerable people in the population that live in that area, including a lot of people who are homeless. So that's the area that causes the health department the most amount of concern within Manatee County, and is where they have some ideas for some pilot programs that they are going to try. And yes, Mary, you're right. That's one of, there are actually 6 community gardens that are supported by the Department of Health around the county. There are also community gardens that are sponsored by the local churches. I call those semi-public in the sense that you need to at least work, the church provides the property and the funding. And so you need to work, if you have an interest in their community garden, you have to at least be willing to work with that church in terms of getting permission to use their community garden. And there are 3 community gardens associated with public schools in the county. So there's quite an effort across the county with regard to community gardens to try and address food desert issues.
I apologize. I came in late, obviously, very late. kind of generally know the definition, but the food desert issue, does that mean there's no supermarkets? There's
Right.
only the little bodega type or whatever, little, buy your groceries at 7-Eleven or something like that. I mean, that's the thing, right? It's more that there's no really good supermarkets.
It is, yes, is the answer. There is no supermarket, and whatever corner store, whether it's a bodega, whether it's a 7-Eleven or fast food, that there tend to be quite a number of fast food outlets, because that's sort of, they tend to have something of a captive audience, even in a place like that. But getting what stores are there do not carry fresh products of any kind.
What about farmers markets? There's so many of those, and
That's not in, there's not one in that area. We're talking fresh fruits and veggies and stuff like that. So that they might have a dollar store.
no, but I mean a farmers market, the markets, the fresh produce.
Area.
Yeah,
And yet
Yeah.
the nature of the farmers markets, and even take the one that Realize Bradenton has, it's pretty large. And they do try and get, they actually have vendors there that will accept SNAP, which is the new term or the latest term for food stamps. But it's a challenge for people who don't have transportation to get to farmers markets that are not located in their neighborhood and actually be able to carry things then back whatever distance they have to carry them. And some of it is also just the culture in poverty is often one that does not include, how do you cook things? Why is it so important to get fresh fruits and vegetables into your diet? How do you think in those terms with enough meaning when you're desperate for anything and everything in your life? So it tends to be a culture that just doesn't make the time or the effort.
Or doesn't have it. Shall we move on to the National Convention coming up?
Yeah, so there's lots of ways to participate in the league, as we all know, and we have an upcoming national convention. And Alice will tell us a little bit more about that.
Yeah, we do have a national convention coming up, and I'm going to talk both about the national and the state conventions. Both are inspirational. Both bring ideas. They have these sessions where you get ideas from other leagues, you get ideas on issues, you get ideas on tools that you can use in the league. In the case of the state, it is every other year, so it's the off year. So the year there's an election, it's just too busy to run one. So next year in June, we're going to have a state convention. Both the state and the national have policies and positions that are, and Ruth will talk about this, that are brought up and voted on. Each league gets a certain number of delegates based on the size with a cap. So like the National League, it's capped at 3, and we get 3. Ignore that. So those are the voting members, but then then you can go, you just can't vote if we've maxed out on our delegates. They're good for also making contacts in the state one. So you're gonna make all kinds of contacts for, this is what got Carolyn on to 411. I attended something on open or national popular vote, and I used all that material. It really helped my presentation. There are link ups that were done with the returning citizens, where they went out and they had talked about the contacts and how we could help as a league. And so then 2 of our members went up and helped run the training for lawyers to help returning citizens. So all those connections get made, you get inspired. So since COVID, they're both in person and virtual. In the height of COVID, it was all virtual, but now they're running them concurrently. Usually the state one is like a moving target for where it is. It's in Venice, it's in Tallahassee, it's in Orlando. So every year, so sometimes it's closer, sometimes it's not, but we always have at least a few people sign up for each of them, and we want whoever goes to share when they come back to our membership what they got from that conference. So we usually had them share with the board. Now we're going to have, I know both Ruth and I are going to virtually be attending the national conference, and we are going to share it with the whole membership. So so far, we've pretty much voted with what we're advised as a from the national or the state as what they feel are the right ones to approve this time. So on this national one, they just have 2 of all the things where they've gotten studies and things in. They've got 2 they've selected that they suggest that we change the position. So you get educated, you get inspired, and we want to encourage our members to go. So we will cover the cost of attendance to any of these state conferences, including the state conference, or we will cover the program costs. Now, the room costs, if you're on the board, you get half a room. And if you share with somebody else, you get that. And for the national conference, if you're on the board, it's significantly more expensive. We cover the cost of the program for board members. So membership on the board does have its privileges. So we'll encourage people to participate that way. So now, Ruth has been active with the National Healthcare Committee and recently brought one of these items back to position changes to our league to say, are we going to be part of the number of leagues that are going to co-sponsor this? And we said yes. And so she has been through the whole process, and she's going to explain how, through careful study and analysis, the league takes its positions on issues. So Ruth, go ahead. You're on mute.
Yeah, I put myself on mute. I didn't want my squeaky chair interfering. I learned about the league's policy process through my membership in at the state and the national level. And I'm fascinated that they use the term consensus. If you look at, there are numerous policy positions that the league has taken at the national level. And all of those policies have been in place for some number of decades in one form or another. I mean, they're constants. Think about the league's support for voting and access to voting and how important voting is. Well, the healthcare policy at the national level has been around for slightly more than 20 years. And when Alice read it at the beginning, I don't necessarily think everyone would have been listening, and some people were a little bit late, but the policy as it was originally drafted and approved more than 20 years ago did not include mental health services. So it was about 8 years ago that the consensus process was used to modify the national policy to include mental health services as part of the league's policy position. And that procedure is one where at least one, if not more than one, leagues at the local or county level decides to undertake a very detailed study of a particular topic. In this case, there were 6 leagues that in the last 5 years have undertaken studies with regard to making changes to the healthcare policy at the national level. None of those went forward in the past, but there was a study done over a course of 3 years by the New York City and the New York State League with regard to the healthcare policy position. It is very, very detailed, substantiated where their data came from and the basis for their recommendations. And that information is certainly available to anyone, but I had access to it. And then the group, the Healthcare Reform for US, then tapped all of our members to suggest that we contact local leagues and ask leagues if they would be willing to support adding a caucus and a vote on modifying the current healthcare policy at the national level. So while I approached more than one league, I certainly started with my home league, Manatee County, and presented the summary written information to the board, and the board did decide to vote that they would approve, they would vote to suggest to national that this be considered for a vote at the national conference. There are a little bit more than 700 leagues in the US, and a total of 98 leagues actually you do it in writing. There was a form that Alice filled out and submitted. 98 of the 700 leagues voted, said yes, they would like it to be a part of it. There is not a specific criteria that national uses, but they want something approaching 100 leagues to support, and we got very close to 100 with the 98, and that was a very, it was leagues across the country. That's a very sizable number of leagues, and so they did review the study that was done and did agree to make it a voting item at the conference. And the definition of consensus is there has to be pretty broad support even to think in terms of bringing it to the National Convention for a vote. There will be a specific caucus before the vote at the national level to be sure that there's information available to any of the leagues sending voting delegates to the league. And when it comes up for a vote, they don't define it as 51% or 70%. but they want very, very broad consensus. And so it's usually something north of 80% for a consensus, for there to be a feeling that there is a very broad consensus and support to modify a policy statement. And that's what I was going to summarize, but I have a sense, Cheryl, do you have a question about the consensus process, or anyone else? Let's see.
Anybody else? One of the questions was, what are the dates and locations? Alice, is that in the resolution process for the National Convention? Is that in that subject there?
Let me bring up that page, which I don't know if it's still there. Let's see. There we go. So you can see that. There's the resolution requirements. The resolutions may be offered by any league at least 4 weeks before the convention. The league offering the resolution may send notice of its text to the chair of the resolutions committee. There's all the information that they need.
But I think the question was, when is the national convention?
Oh, the national
Did
convention.
I misunderstand that?
It's June 24th, 25th, and 26th, or 23rd, 24th. That's probably right here somewhere, since this is about the convention. Let's see at the bottom.
Dawn, you want to unmute yourself and say something?
No, I think that she scrolled by it when she was doing that link, but I think it was closer to the top page, but maybe I'm wrong. If it's closer to the top.
Well, it's just got about right.
Oh, okay.
It's just the date that you have to submit it, which
It's
is,
on the website. I can find it up.
Yeah.
I'll look it up while you're talking.
well, actually, I can look it up right now because it's on my calendar. So if I go, it is.
You're not going to look at the calendar in a
June, it's June 23rd, 24th, and 25th.
And Trish Neely just asked, is anyone going from Manatee in person?
No, but next year it alternates with DC, the national. And actually that time of year, it would be pretty easy for me to go there. So I'm considering next year, but it's in Denver this year. So we'd send Dawn because she's going to be.
I just got back from Denver.
I want to thank both Alice and Ruth for your contributions tonight. And Ruth, in closing, for your particular committee, your action team at this point, do you have any special requests from all of us in regards to, do you need more members on your team? Is there any support that you need from us directly?
Well, I'm going to make one comment that I left. I talked about the process of consensus. I didn't talk about what we have actually suggested be the modification to the policy. And the modification that is being suggested is to change the policy to specifically support. They haven't settled on whether the terminology would be single payer or improved Medicare for all, but to actually support the government providing the funding for healthcare, as opposed to the current wording, which comprehends something like single payer, but does not specifically support it. But so I just had to put in that plug. We're trying to change. One of the sayings we have is we support health and the delivery of health, and not health insurance. But specifically, what I would really like to have is a co-chair. I have asked a couple of people currently on the committee specifically, and they have had their own personal reasons why they could not take on that challenge. But having stepped up to becoming vice president for the organization, which means I'm destined to be the next Alice at some point, I would like to have a co-chair who would ultimately be able to take over that committee, because I can't do that. And I'm not sure I can be nearly as good as Alice is, but I really could use a co-chair for the healthcare committee.
All right, well, that's, you put it out there, and if anyone wants to ask Ruth more about what that entails or how they can participate in supporting her, her details are right up there at the top of the chat. Someone just asked a separate question from tonight's topic, and Susan Fingerman asked, why are we changing the annual meeting venue? Susan, we were just looking for suggestions, that's all, just to do some homework, just so you know. And we're going to stay right at this point. We're going to stay where we are, where we had it this year. But thank you for the question.
It was my first one and it seemed very nice. So I wondered why.
No, I think
Just curious.
Thanks for the comment. The goal was just really do some homework. And as new restaurants and new hotels are being built, new venues are being built, find out what's in our highest and best interest. And Allison, Alice, any comment about that?
No, I think Cheryl has explored quite a number of one, and we're actually at this point, we're pretty darn certain we're going to go back there next year. But the year after, we want to look at, weddings and all that kind of stuff. We want to look at other options. Sometimes it's nice to try, to do in a slightly different area and get a different, maybe a little more east for one time and closer in the next time. But it is nice. We really enjoy it there. And it is, it's very nice.
So we're going to close out next with our second poll of the evening.
Well, let me do one thing quick before that. I just want, for people's edification, is to show you the different types of things at the national, which are not going to be as specific as the ones I talked about, where they talk about the program they did of how they train new people to be on the board, or how they so you can see energizing young voters, civic capability in a time of disinformation. So there are things you'd be interested in seeing. Unfortunately, they run most of them at the same time, and on the local ones it's different. So now I have a technical issue that I don't know why, but it tells me I'm signed in someplace else and I don't have polling. So I'm going to read it and everybody can raise their hand.
Okay.
When was the first time the League of Women Voters had healthcare on their platform? In the 1930s, 1930s, when through Eleanor Roosevelt and the New Deal, which Eleanor Roosevelt was a League of Women Voters member and a very active one. 1946, in support of the proposal for universal health care by Harry Truman, which he did propose. That was the first serious one. 1920, in support of the health care of mothers and infants. And as all of you, of course, know, 1920 was the founding of the League of Women Voters, or 1993 through the League of Women Voters Education Fund. So 30s, A, 46, B, 20, C, and 93, D. Okay, how many vote for the 30s through Eleanor Roosevelt? Raise your hand. We got one, right?
Great.
Court Eleanor. No, I don't know.
What, okay, 46 with universal health care. How many vote there?
One.
One. 1920. How many vote there? One, two. Is that it? Three? Okay, 1993. Who's voting there? Okay, the answer is 1920. Most of you got that correct. 1920, the original platform, there was a huge infant mortality problem and a huge mom death problem in birth. And so they lobbied from that and through that and Rankin, Jeanette Rankin, the first woman to be a congressperson and also a congressperson before women had the right to vote, helped push it through. It ran for, I don't know, about 7 years or 8 years. And then the southern states started calling it socialism and they got it blown out. There was a bunch of clinics and stuff like that. So anyway.
Thank you so much, Alice and Ruth and everyone for participating tonight. I want to remind everybody to check out our website and be sure to join or renew your membership if you haven't already done so. And I also want to let you know that the next taste will be July 14th at 5:30 p.m. to 6:30 p.m. And the topic of the evening will be voter services. And we'll not only hear from our voter services chair, Carolyn Sheets, but we'll also host the Florida Voter Services Chair, Marisol Zenteno. That's it for tonight, and thank you all. Bye-bye.
Thank you, everyone.
Thank you.
Thank you. Oh, I'm looking for the stop record button. Oh, there it is.